Welcome back to Rural Health Summit, a season of Rural Health Today. In this season, we're sitting down with a series of guests at the MHA Annual Summit meeting, where many healthcare executives and leaders across the state meet to review the last year of collaborative efforts and the work that we've accomplished. In each episode, I'll ask my guests to give us an update on their hospital or healthcare organization and to touch base, so to speak, on the healthcare issues they see that is most pressing in their corner of the rural health world. Welcome to the third episode of our Summit series. Today we're talking to my good friend, leader here in Michigan of the Michigan Health and Hospital Association, the one, the only, Brian Peters, Chief Executive Officer and President. He's been on our podcast many times. We're stopping by today just for a quick update about some exciting things that are happening. Michigan Hospital Association is hosting our annual summit meeting, and we're discussing a lot of relevant and current issues that our hospitals and member hospitals, regardless if you're a critical access or 800-bed, that we're facing collectively together. But Brian, the focus of our discussion for the last few days has really been around the work that you and your team have engaged in over the past year, and it has been a lot. The good news is our program year is coming to an end, so I'd love for you just to talk a little bit about that. But before we do, you have a rich history with MHA. Why don't you let our listeners who may not know a little bit about you in terms of what you do at MHA and how long have you been there and the purpose of MHA first?
JJ, thank you so much. It's always a pleasure to be with you on the podcast. And you're right, this has been a very active MHA program year, and pleased to be with you and all of our members at our annual meeting to celebrate our success, but also talk about the path ahead. And to answer your question, this is now my 35th MHA annual meeting as a member of staff.
It's hard to believe. Were you like 10?
You know what? I used to be 6'3" and had a full head of hair, as the old saying goes.
Oh, wow.
And,
okay, though those 35 years have been rough for you then.
It can be a stressful job, but it's one that I love, as you well know. And it's always a wonderful tradition to have our members and our staff together in one time, one place, where we can commiserate, share some of our common challenges, but also come together around our strategies and how, at the end of the day, we can accomplish our mission, which is a noble mission, and it's one I'm very proud of. It's advancing the health of individuals and communities, all 10 million Michiganders. And again, we did it this past program year. I'm confident we'll do it again in the new program year.
Well, you've had your fair share of successes, and we've had our fair share of challenges as a system in the state of Michigan for healthcare. But let's talk about the key takeaways from the previous program year. So the one we're closing out now, what excited you the most about some of the work that we've done and you and your team have done? Maybe one or two projects that you're just absolutely thrilled that we were able to accomplish.
Well, absolutely. And it's a timely question because we literally just put the finishing touches on our annual report, which will be communicated to the entire membership here in the next week or so. And when you think about the Michigan Health and Hospital Association, we are, on the one hand, a relatively small organization with about 100 employees, but we are involved in such massive issues. And I think people tend to think of MHA, as you would expect for a trade association, in terms of our advocacy work, both at the state and federal level. And certainly there's been a tremendous amount of activity and success there, and I'll talk about that. But we also have, as you know, a for-profit arm, the MHA Service Corporation, that is involved in so many very impactful activities. And then we have a 501c3 nonprofit arm that includes the MHA Keystone Center. And that Keystone Center has been involved for almost 3 decades now in the safety and quality improvement space. And literally, to your point about this program year that we're just wrapping up, just about to receive a new 5-year contract to continue that safety and quality work.
That's phenomenal.
And what's really exciting about that, to be renewed in that way speaks volumes about the value that the federal government sees in this
work that's being done.
But we weren't just renewed. We were given an entirely new region in addition to the region that we've been working in for the last number of years. So very exciting there. The point being, JJ, we can talk certainly about the political and public policy space, But there's just a lot that's happening within the association that we're very excited about.
Yeah, you've had a heavy lift, and you've done a remarkable job, Brian. We're very proud of your work. Let's transition a little bit. So a lot of success. Your team have done a great job. But I would say healthcare in this country is in crisis mode right now. There's been a lot of issues that we've been closely monitoring, but none as challenging and most significant, in my opinion. And it's deep cuts to the Medicaid, billions of dollars, as we know. I think what was most important is that, we lift our voices, which MHA has done.
Well, you're exactly right. There is public polling data that shows very clearly that the strong majority of Americans look at this particular legislation and are opposed. They believe that jeopardizing access to health care by cutting the Medicaid program over this 10-year time horizon is wrong-headed. And I would say to any elected official, you need to take heed of that feedback.
Absolutely.
Your constituents around the country, whether that's urban or rural, red states, blue states, everything in between, they are saying, wait a minute,
this isn't good.
These are my friends and neighbors and family members.
And our pastors and our farmers.
Absolutely, who are covered by the Medicaid program. And so this rhetoric that says we're only going after waste, fraud, and abuse, that is not accurate. Is there waste, fraud, and abuse in the system? Sure, and we want to root that out as much as anyone else. But the provider tax programs, the state-directed payment programs, of which we have a very strong one here in the state of Michigan, and we have for some time, they are not waste, fraud, and abuse in any way, shape, or form. These are programs that have been developed at the state level under both Republican and Democratic governors. They go through a very significant process before it's even submitted to the federal government.
To the federal government, who approves it,
and
by
again,
the way.
with Republican administrations and Democrat administrations. And this is not a program you would design if you had the opportunity to wipe the slate clean and design a healthcare financing system from scratch. But that's not reality. Reality is we have to have a program in place that assures that our hospitals, physicians, and all of our healthcare infrastructure is adequately funded to continue providing access. And JJ, by the way, you and I have talked about this before. This is not a Medicaid-only discussion because if you have to curtail a service line or you no longer have the financial means to recruit and retain a specialist physician in your community, that doesn't just mean lack of access for Medicaid recipients. That's lack of access for everyone in your community, no matter how well insured they may be. And so we've really been doubling down on making that point crystal clear to anyone who will listen.
Don't you think it's I don't think the word ironic is applicable in this conversation, but it initially started as a tax break. It's tax reform is what they wanted to look at. But they're doing it on the backs of hospitals and providers. And those hospital and providers are not going to be able to service their community in the way that they've always done if these cuts come. But isn't that just ironic? You've been around a lot longer than I have in this industry, but that flipped real quick from a tax break to a let's have a reform on Obamacare.
Yeah, the irony is clear. And we can look back in time and understand the politics of the Affordable Care Act and all the different machinations there that have involved Congress. They've involved the United States Supreme Court. They've involved state legislatures when it comes to deciding whether or not to become an expansion state, for example. So there are very clear politics here. But I think at this point in time, one thing is clear. Medicaid writ large, but the Affordable Care Act as well, have really come together to create enhanced access for Americans. And whether that's someone that's accessing insurance through the exchange, or whether that's someone who is in an expansion state like Michigan, which, by the way, passed our Healthy Michigan plan, our Medicaid expansion, under a Republican governor with a Republican legislature.
Absolutely it did.
It's really troubling to me and my colleagues to look at any sort of erosion in that, because we remember the days when we had a very significant number of uninsured Michiganders. And JJ, you see that every day.
Every day.
What that means in your community, it means people are going to be using the hospital emergency department as their entry point to the system, and probably not in the best time frame either. In other words, we won't be able to identify problems early on with a screening that could appropriately identify something that we could treat at lower cost and with better outcomes for patients. I mean, that's the whole idea behind getting people insurance coverage, whether that's Medicaid, Medicare, or private insurance. That's the notion behind it. And to see any backsliding on that it's very troubling, to say the least.
So as you hear this podcast today, the three challenges we'd give you is to listen up. This is a very serious issue. You need to step up, and then you need to speak up. And those are three very important things that you can do as you listen to this podcast today. Brian, there's a lot more that we could go into. The producer just told me that we're running out of time. Can you give us one exciting, let's say, program, one exciting area of MHA that you're really looking forward to in the new program year?
Well, I'm really looking forward to continuing the positive momentum that we've developed on the workforce issue. Remember that the MHA Board of Trustees now for the last several years, ever since the pandemic, frankly, has lifted up workforce as one of those areas to work on proactively. In other words, we play defense an awful lot on wrong-headed ideas in the state legislature and at the federal level as well. And we've talked about playing defense now on this particular piece of legislation at the federal level. But on workforce, we've actually created an awful lot of success by lifting up healthcare as a potential landing spot for young people who are considering their career path, understanding that healthcare has a lot of open positions today.
That's right.
And given the demographic reality of an aging population, there's only going to be more of those opportunities in the future. And so the MHA has fully embraced that, working with the higher education community and other partners, and certainly working with Governor Whitmer and her administration and the state legislature to create funding opportunities and policy change that incentivizes people to join this large and growing workforce.
So you heard it here directly from Brian Peters, president of the Michigan Health and Hospital Association, doing a fantastic job leading that organization and supporting up our hospitals throughout the state of Michigan. And by the way, the only association that has 100% participation of all hospitals in the state. That's something that's pretty significant. Brian, always friend, leader, and mentor of mine. It's great to have you on the podcast today. Hopefully we can get you back again soon.
JJ, thank you so much. Always a pleasure, and I look forward to that opportunity.
Stay tuned for the next week's Summit Series update with another great guest. Until next time, remember the power of rule. And thank you to our listeners for tuning in to Rural Health Today. Catch our next segment, Rural Health News, to stay up to date on the current state of rural health care every Monday, wherever you get your podcast. Don't forget to check out our latest updates and resources from Rural Health Today at ruralhealthtoday.com, and make sure you've subscribed to the show so that you never miss an episode.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to our guests for sharing their expertise on the show, and also to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.